Hello everyone, welcome to the channel. Today we will explore the anatomy of the skull, its parts, major sutures, important openings, functions and clinical notes. The skull is the body framework of the head. It protects the brain, supports the face and provides attachment point for muscles involved in chewing, facial expressions and head movement. The skull has 22 bones divided into two main groups designated as the neurocranium, which are the cranial bones, and the visceral cranium, which are the facial bones. The neurocranium are the cranial bones. There are 8 in number. They protect the brain and they include one frontal bone, 2 parietal bone, 2 temporal bone, 1 occipital bone, 1 sphenoid bone, and 1 ethmoid bone. The visceral cranium are known as the facial bones. They are 14 in number and they form the face. They are as follows: 2 maxillary bone, 2 zygomatic bone, 2 nasal bones, 2 lacrimal bones, 2 palatine bones, 2 inferior nasal concave bone, 1 vomer and 1 mandible. Of the head, the skull are joined by immovable fibrous joint called sutures. They are coronal suture. Coronal suture connect the frontal bone with the parietal bones across the skull. We have sagittal suture. The sagittal suture joins the right and left parietal bones along the skull midline. We have the rhabdoid suture. The rhabdoid suture connects the occipital bone with the parietal bone posteriorly together. And we have the squamous suture that joins the temporal and parietal bones of the skull in the lateral side. The skull foramina are openings that allow for passage of arteries, veins, and spinal cord. The major ones are foramen magnum that allow the passage of spinal cord. We have optic canal that transmits optic nerve. We have jugular foramen that transmit cranial nerves 9, 10, and 11. We have carotid canal that transmit internal carotid arteries. We have many of them. Skull functions to protect the brain, support the eye and nose and mouth, form cavities of the brain and sensory organs. It provides attachment for muscles of mastication, facial expression, and neck. When a fracture occurs on the skull, it may damage the brain, cranial nerves, or blood vessels. Making prompt diagnosis and treatment is very, very essential. Alright, that brings us to the end of today's lesson on the skull. Understanding the skull bones, sutures, foramina is the foundation for learning head and neck anatomy, neuroanatomy, and clinical medicine. If you find this video helpful, please like, share, and subscribe to the channel for more easy and understanding anatomy lessons. Don't forget to turn on the notification bell so you never miss a new upload. Thanks for watching, and I will see you in the next anatomy video. Thank you.